I would like to say that I specialize in back care because I'm brilliant, but I specialize in back care because I'm broken. So I've had a lot of injuries, but I always tell people yoga can cure or heal. It's the proper application and knowing your body and what works best. And when you don't have space in between here, you start to get bone on bone compression. Anytime a bone touches another bone, more bone grows. It will get better. So the main thing with healing, increasing circulation, stabilizing what's unstable, strengthening what's weak, and, and working on the alignment. Bring the weight more onto the back leg and come down. First of all, you feel kind of pretty because it's more of like a plie, but this is doing the work, not my back. And we do have large muscles in our back, but we have a lot of small muscles in our back too. And if we're not employing the muscles in the correct way, sometimes other muscles have to take over, say a smaller muscle has to take over for what a bigger muscle should be doing. So anytime you have pain, and you have quite a bit of pain right now, you want stabilization. And then you're holding the sink, leaning back, and then if you have someone around who could gently grab your hips and lightly traction, that's another nice way to do it. I'm not a fan of hanging, just because of what it does to the rest of the joints. But something about that, the lean back, hold on, and then keep the belly pulled in, take the hips slightly one way, breathe into this side. That's going to get the QL. Then take the hips the other way, breathe into the other side. The QL, again, it's on both sides. Sometimes just one gets tight. And so you'll see this. And generally, if you see this kind of alignment, you're going to assume someone has scoliosis. Not necessarily true. They could have a tight QL that's pulling that up. And if you lengthen the QL, I was getting a lot of back pain, and there's cobblestones, and I'm sure I wasn't wearing the best shoes because they had to be kind of cute too. And it dawned on me, oh, engage your core. So it's that internal corset. Pull the belly in and lengthen. As soon as I started doing that, the pain went away.